Hello, my name is Dai Kim, and I'm completing my master's degree in art and technology at Jeonnam National University. Today's topic is healthcare service design for older adults with chronic diseases. Korea's older adult population is growing rapidly. The older adult population aged 75 years or older is expected to account for 16% of the population by 2037 and 24.7% by 2050. The number one cause of death in Korea is chronic diseases, especially peanuts given that the proportion of older adult people is high. Therefore, healthcare for the older adults is an important social problem, and the need for healthcare continues to increasing as the number of older adults with chronic diseases also continues to grow. Neglecting chronic diseases prevalent among the older adults not only increase the economic burden but also cause problems such as social isolation and growth in the social inequality gap. To solve these problems, efforts are needed to protect health and individual and social level through prevention, early detection, effective treatment, and management. The study was conducted to provide services that help the older adults improve their quality of life and promote healthcare. First, we examine the problem area. Chronic diseases can be prevented by improving lifestyle habits. However, despite this knowledge, incidence rate of chronic disease continues to increase throughout Korea. The Korean government and companies are developing various programs to prevent and manage chronic diseases through mobile application, but are having difficulties with these applications owing to technical difficulties along with physical and cognitive restrictions present by the older adult. Therefore, we aim to solve the aforementioned problems using a mobile application design with customized healthcare services for the older adult. To start off, I would like to discuss the following three research needs to explore the necessary and importance of healthcare for the older adults with chronic diseases. First, as the older adult population increases, the importance of preventing and managing chronic diseases increases. As a result, effective healthcare services are needed to improve their quality of life and ensure a healthy retirement. Second, technological advances have enabled the provision of personalized services through artificial intelligence and mobile applications. However, the older adults experience difficulties in using these services because of technical difficulties or limitations in digital accessibility. Thus, they are in need of customized services. Finally, interested in and needed for healthcare for the older adults is increasing and expectations for their medical expenses and health service are growing. Accordingly, a service that allow older adult people to manage their health independently is needed older adults. In recognizing the need for research, we have conducted a study on the design of effective healthcare service to improve the quality of life and healthcare of the older adults. To understand the need for such research, we conducted a case analysis focusing on service products that provide healthcare services to the older adults and help improve their quality of life and healthcare older adults. I will briefly explain the services in CareAngel, Tempo, LQ, and Marble. First, CareAngel. CareAngel is a startup founded in the United States in 2014 and has commercialized a system that utilizes artificial intelligence promoting older adult care services. CareAngel improves the quality of life of the older adults by providing simple and personalized care older adults that is easy to use. Second, Tempo. Tempo is a wearable device developed in 2013 to monitor and predict the health state of the older adults in real time and informs the older adults of their health problems in advance, communicating this concern with their guardians through functions such as location information and two-way signaling. Third, LEQ. LEQ is an artificial intelligence companion robot for older adult people living alone. Developed in Israel in 2009, it interacts through voice commands, perform routine functions, and provide customized services. LQ provides recommendations based on the taste and preference of the older adult and is a customized care service that improves quality of life and help promote the creation and maintenance of social consent of the older adult as it allows for communication and interaction with family members. Finally, we turn to Marble, a healthcare logo with an attractive yellow color. The artificial intelligence health helper Marble, developed in the United States in 2015, is a robot capable of AI conversation. It was designed to help patients with chronic disease manage their health at home. The model can observe the health of the older adults and can interpret their emotions by observing their facial expression. To prevent rehospitalization, we interact with patients with chronic disease to conduct conversation. It also provides various functions such as schedule management and medication notifications so as to help patients live their daily life in convenient manner. Healthcare services such as CareAngel, Tempo, LEQ, and Marble are useful contributions to improving the quality of life and healthcare of the older adults. However, the older adults still have difficulty using applications and technical devices. Therefore, future studies should consider ways to improve the interface or usability to make these services easier for the older adults. In addition, empirical research is needed to determine how these healthcare services affect the healthcare state and quality of life of the older adult. Next, we explain our research method. We divided the healthcare service UX area and healthcare quality area between the older adults with chronic diseases and conductive survey and in-depth interviews to drive implications for healthcare service. Through this process, we identified which factors are important and what the needs are in order to improve the healthcare and quality of life of the older adults living with chronic diseases. We subsequently came up with measures to improve the service so that the older adults can use it more easily. In this study, we designed persona and customer journey map in order to identify the needs of the older adults and proposed a healthcare application design that considers psychological and physical changes. Through this process, we implement services aimed at improving eating habits, providing customized diet, and introducing exercise methods, healthcare related education, and telemedicine for the older adults, thereby minimizing inconvenience in use. Let us consider the result of the problem-solving efforts that have taken place. Healthcare service design effort a variety of features, including medication, water drinking notification, health data management, sleep data analysis, and hospital scheduling. Thus, the older adults can experience mobile app interface that allow them to take care of their own health. The healthcare application design derived from these studies is expected to help the older adults manage their life more conveniently and easily and contributes to a better quality of life. Finally, let us turn to the conclusion, risks, and implications therefore. Studies have confirmed that older adult people living with chronic diseases can solve their own problems and are able to receive effective healthcare services that can improve their healthcare and quality of life. In addition, to expand and distribute healthcare services, it is important to create a service environment whereby the older adults can prevent problems and manage their own health through cooperation and contributions improvement of not only the older adults but by guardians, medical staffs, and social welfare institutions as well. Through multimedical participation and teamwork, we will be able to achieve better results in improving the health and quality of life of the older adults. This finding can be referenced in the design and improvement of healthcare services in the future. It was concluded that continuous efforts are needed to improve the quality of life of the older adults and to provide better health care services. We hope that this study will help the improve the healthcare and quality of life of the older adults. Thank you for your attention.